Well, what are some of the other threats to employee or perhaps patient safety that are just top of mind to you at Inova?
One big thing, and we hear this all over healthcare now, is workplace violence. Right? Workplace violence it's growing. It's getting worse. Our team members are consistently being faced with verbal aggression, physical aggression. And, right now I co-chair our system workplace violence committee. And we're really trying to push out new initiatives, focusing on data collection and focusing on the incidents that we have at Inova and trying to guide or create a roadmap as to how we can create a safe environment for our team members. Because again, it goes to resiliency, right? At the end of the day, everything that my job is creating that resilient environment and defending Inova's brand.
Yeah, that makes a lot of sense. I mean, I think I remember reading a statistic recently that healthcare workers face, I think, more than almost any other group out there, workplace violence. What do you do about that? What's like the top thing you can do to help maybe create a calmer environment or train up your people to deal with those situations and know what to do to, get themselves out of it?
Yeah. And we kind of take both approaches, right? So we ensure that we're creating a calming, nurturing environment for our patients and our visitors. But we also ensure that our team members have the proper tools, right? So we've got a plethora of different resources that we provide our team members. Every one of our team members goes through de-escalation training, so they have the proper tools to deal with the situation. We've also implemented weapons detection systems, which we have at all of our entrances, all of our main ED entrances and our freestandings, which will identify a weapon coming into a facility. We've increased the amount of security officers that we have. So really, taking all these different aspects and bringing them into one really creates that comprehensive response that we have to workplace violence. And, we're constantly looking for new training, new initiatives, new products out there to create a safe environment for our team members.
How would you describe your approach to running an effective emergency management program overall?
Yeah, I think it's really just that collaboration and communication, really, and that's internal as well. So a lot of what I do, I rely on other subject matter experts, right? I'm not a doctor. I don't know the clinical process. I'm not a pharmacist. I'm not supply chain. But if I can sit down with those people, build the relationships, and pull the critical elements of information that I need to develop their plan, then I've succeeded, right? And then going back, once that plan is developed, it's not, okay, we're going to, put it on policy stat because it's now completed. It's reviewing with them on an annual basis. What has changed in your process? What new team members do you have that we need to educate on what the plan is? And then, what integrations have you had since we last wrote this plan that we need to focus on? If my team doesn't capture that and make sure that we have a plan, if that fails or a plan for continuity of operations, then we're going to let the entire enterprise down. And really, it's building those relationships and understanding. I'm constantly learning, Peter, and I try to educate myself around the healthcare as a whole. If I read something about supply chain or pharmacy, that's more knowledge that I have that I can bring to the table to help my team, build and exercise and train on their plans.